Well, Omicron has prolonged the pandemic. It's the fifth variant of concern. COVID is here to stay longer because of this new variant. Top medical experts decode on what are the kind of long-term implications of Omicron in terms of long COVID. Take a look.
Mild infections, less severity in majority of the cases all over the world. By and large, that is how the clinical picture of Omicron is looking like. But how bad can things get after recovery? In short, how will Omicron-induced long COVID look like? Experts say it's a little early to say given the variant has been identified just 2 months ago.
Is there any kind of symptom which is persisting after 4 weeks? So we really have to wait for this kind of wave to abate and follow up our patients in outpatient to see if they are getting any kind of problems.
Some doctors say early symptoms are mostly fatigue after the patient has turned negative on RT-PCR. But some things may not change.
Patients who are recovered from mild infection, they usually complain of backache, body ache, lethargy and post-viral cough, which usually resolves in 2 weeks. So that is the maximum period we are seeing the symptoms even after recovery.
But some things may not change. Be ready to see symptoms of multi-system inflammatory syndrome in children, warn some experts.
One needs to be cautious about is MISC in children.
There is no evidence in any of the global data of high amounts of MISC. We will only get to know, in due course of time.
That in Delhi and Mumbai, for example, and other parts also, where the deaths are increasing. Is it mostly because of Omicron?
So deaths happening now from infections in January are mostly Omicron. Deaths in early January because of infections in December were mostly Delta.
Some experts cite data to show vaccines may just help against long COVID. A study published in the Lancet Infectious Diseases Journal found that people who had received 2 vaccine doses and suffered breakthrough infections were about half as likely as people who had not been vaccinated to report symptoms lasting at least 28 days after their infection. About 5% of those with breakthrough infections reported such lingering symptoms, the study found, compared with 11% of infected people in an unvaccinated control group. The study was based on reports to a phone app by more than 1.2 million British adults who had received at least 1 dose of a coronavirus vaccine between December 2020 and July 2021.
The vaccination provides protection against the COVID. It prevents not only the acute symptoms of COVID, but also it prevents the occurrence of long COVID, as this was stated in a study published in the Lancet in the January 2022. So at the earliest opportunity, we should get ourselves vaccinated.
It will be a while before we learn about the long-term impact of Omicron in terms of long COVID. A host of factors will determine this, like population demographics and also vaccination rates. Up until then, it does appear that there are no major surprises when it comes to long COVID because of Omicron. In New Delhi, Sneha Mordani for India Today.